Hi, welcome to Functional Fridays. I'm Dr. Sherry Jacobs, and this is Dr. Shannon Kennedy. Common problem is high cholesterol. See it all the time.
Yes.
Tons of people on statin medications for lowering cholesterol, and I think we get two people in. Some people that know that they have cholesterol issues and they're not ready to go on statins, and then we have other people that have been on statins for many years. They hardly even remember what their initial values were. It just is something that has been given to them. Regardless of who those patients are, I think always asking the question: if your cholesterol is high, why is it high?
Yes.
And I think, unfortunately, I think in fast-paced modern medicine, we see something high and we lower it, but without asking the question why. So why are people's cholesterol levels elevated?
Yes, and again, being trained in conventional medicine, I was trained to treat over 200. We put people on cholesterol medications, even regardless of the type of cholesterol that they have. So one of the things we look at right away is what type of cholesterol do you have, and what is the particle size and proteins and other things in the body that can contribute to whether your cholesterol is working for good or working for bad. You have to remember that cholesterol is one of the most important molecules in the body. It's the precursor to most of your hormones.
Mm-hmm.
All of our cells, the lining of our cells are made of cholesterol. Our brains are primarily made out of cholesterol. So when we drive down cholesterol production in our body, we are also decreasing the ability to produce those good things. And people often don't feel well on cholesterol medications, and they just don't want to be on them. And the good news is that many people don't need to be on cholesterol medication if they can make some lifestyle changes, which is why working with you has been great, because while I can tell people maybe why their cholesterol is high, I have a hard time getting people to make those lifestyle changes, and to commit to the importance of doing so. So anyways, that is one of the big topics that we see people for.
We do. And I think it's really interesting to me because you almost feel like there's some bragging rights sometimes with folks, because they'll say, my cholesterol, and they'll give you a number about how low their cholesterol is, and they're excited about it. But really, we do see so many negative effects. Particularly men, you'll see men oftentimes that they've got these really low, 130 or 140 total cholesterols, and but then their testosterone's in the tank.
Yes.
So there's a whole other health issues that come with low testosterone and how you feel on a daily basis. And so it really is about balance. And again, asking that question, why is your cholesterol low? Because if we're cutting off the cholesterol pathway and we can't make things like testosterone anymore or healthy hormones anymore, that's not a very good trade-off.
It's not. The body is amazing that it does things like raise our cholesterol. It's a sign that something else is wrong in the body. And so to just simply treat the high cholesterol with the cholesterol lowering medication, we're doing a disservice. The cholesterol is high because something else is not balanced in the body. So we look at hormones, we look at nutrition, we look at stress, cortisol levels in the body. All of those things affect cholesterol levels. So what if we just gave a cholesterol medication and let that other process run amok? We're going to end up with more disease, and we're going to end up with people not feeling well. Cholesterol doesn't want to stick to the inside of your blood vessels. That's not what it's there for. It will do it if you are inflamed, if you have hard calcified blood vessels, if you have an underlying inflammatory condition or infectious condition like Lyme disease or something like that. You're going to have inflammation, and your cholesterol is going to try to help out by sticking, and that's when plaques are formed. So we want to treat those underlying disorders so that your cholesterol can remain at the level it needs to be in the body, doing the things that it needs to do in the body, and not causing plaque buildup. And we like cholesterol. We're cholesterol fans here.
Yeah.
But we want it to be doing your body a service and not a disservice.
So always ask why.
Always ask why.
Thanks.
Okay. Thank you.